morning, guys, and welcome to Chapter 14, the integumentary system. Okay, so we're going to try something a little different today, and I'm hoping that this is going to make things a little clearer for you guys as we move forward coding in our CPT. The very first thing that I want you to do is pull out your textbook, whether it be 2020 or 2019 edition, and I want you to turn to Chapter 14. Let's look at our learning objectives. Describe the format of the integumentary system in the CPT manual. So you're going to find that underneath integumentary system, and that's number 1. So the first thing that we're going to talk about in your textbook is the format. So let's just move this over, and then right here is our format. I'm hoping that you can look in your book so you really don't need to read what's in mine. But this says the subsection is formatted on the basis of anatomic site and category of the procedure. So you're going to be looking for anatomic site and the category of the procedure. For example, an anatomic site is neck, and the category of the procedure is repair. Okay, so the subsection integumentary system contains the subheadings. So let's take a look. We have skin, subcutaneous and accessory structures, nails, polondial cyst, introduction, repair, closure, destruction, and breast. Each subheading is further divided by category. For example, the subheading skin, subcutaneous, and accessory structure is divided into the following categories: introduction and removal, incision and drainage, debridement, paring and cutting, biopsy, removal of skin tags, shaving of the epidermal or dermal lesions, excisions, benign lesions, excisions, malignant lesions. And you're going to see there's nothing else here. This is where it goes into something a little different. But we're going to focus on this. But we're going to focus on this in your CPT manual. So I would like for you guys to kind of set your textbook over to the side, and I want you to pull out your CPT manual. Let me see if I can adjust just a little bit to be able to see this a little better. Here we go. I think that's good. You can't see everything. Let me push it up. Okay, here we go. So I'm going to actually go back and remind you that in the green, these are your guidelines for your surgery section. The integumentary system is part of your surgery section. Okay? So here you're going to see the integumentary system, and it starts with skin, subcutaneous, and accessory structures. Do you remember us reading that as your first subheading in the integumentary system? And then what you have after that is categories. So introduction and removal, and so on and so forth, you can find that. So what I want to do now is I want to actually open up where we're starting. After general, you're going to come on over and you're going to see integumentary system. And I'm not giving you page numbers because some of you have different editions of the CPT, but you should know where you're at just because you're in surgery, and right after general, you turn the page and you're coming to the integumentary system, and this is where we're starting. Okay, now you guys see all this lovely highlighting and things that I have. If you're getting in your CPT manual and you're seeing what's there, when you're listening to me lecture or when you're trying to code, you're going to know what you're looking at. Now, you're going to be able to see also that I have also tabbed IND, which is my incision and drainage, debridement or debridement. It just depends on how you want to say it. Then I did biopsies, skin tags. Okay, and I'm sorry, right here, excision of benign lesions. And then this is excision of malignant lesions and nails. Oh, sorry. repairs, skin replacement surgery, flaps, ulcers, burns, local treatment, destruction, and the last, Mohs surgery, and then mastectomy is my last one. Okay, so I like this because again, I can see everything. I have some on the side and then I have some up top. This is how I like to do it because I know if I'm looking for an incision and drainage, I know where I'm going. If I know I'm doing biopsies, I can just pull this. If I know it's an excision of a malignant lesion, I can just do like that. Now, does that mean I don't need to use my index? Of course not. But because I have my CPT labeled and I know what I'm doing, if I'm using my scenario and I'm coding and I know that it's a nail, then I can just do that because I have my notes written and I know what I'm looking for. But anyway, okay, that is my actual tabbing exercise, my tabbing that I like to do. So what we're going to talk about is we're just going to start talking about every little bitty section. And I didn't bring different color highlighters, so I want you guys to bear with me while I run go get those. Take this time to get you some highlighters and some tabs and whatever you think that you may need. I'm just grabbing some different colored pens, anything that I might need. I should have had this done before I sat down, but anyway, so some of you guys seem to be having some trouble catching on as we're coding. So I thought we would try a different approach this time. We're going to actually go over what's in your CPT. So integumentary system, we have the skin, subcutaneous, and accessory structures, introduction and removal, and that starts with 100300. Now, I did not put a lot of notes on this, but I know this is fluid collection by a calf. Okay, you have more codes here. Placement of soft tissue localization devices, and then this is an add-on code. Then here we're starting our incision and drainage. So I'm actually going to grab my notes because I have some here. And I want to talk about tips to choose the right codes for incision and drainage procedures. When deciding on which codes to use with incision and drainage procedures, it's helpful to ask 3 questions. What will the subject of the incision be? Will you perform one or more incisions? And is the procedure simple or complex? Abscess, cysts, and more. How you answer the above questions will determine the correct codes to report incision and drainage services. Here's a review of the major categories of CPT codes for this type of procedure. Abscesses. The first code in the CPT series for incision and drainage, 10060 through 10061, defines the procedure as incision and drainage of abscess. And it could be a carbuncle, superlative, hydronitis, cutaneous or subcutaneous abscess, cyst, bernacle, or parenchyma. Simple, single, or complex, or multiple. Well, let's take a look at that. Now, if you look at CPT code 10060, I'm just wondering if I need to get closer, if you can see it better. Here, let me take it off. I'm sorry, don't get seasick on me. So 10060, incision and drainage of abscess, and I just read what all of that included. All of these things. Then 10061 says complicated or multiple. So 60 is simple, simple or single, and 61 is complicated or multiple. Now let's look at 10080. Incision and drainage of a pilonidal cyst, simple, and 81 is complicated. And see, I wrote pilonidal cyst here. Then if you look over to the other side, incision and removal of foreign body, subcutaneous tissues, simple, 1021 is complicated. And then I wrote removal of foreign body. 10140, incision and drainage of hematoma, seroma, or fluid collection. 10160, puncture, aspiration of abscess, hematoma, bulla, or cyst. And I wrote puncture beside that. Then 10180, incision and drainage complex post-operative wound infection. So I wrote IND, complex post-op. And then I actually spent the time and made sure that I have highlighted those in different colors. There we go. See how I did it in different colors to say that it says different things? So we're going to move on to debridement or debridement. Here, let me make sure that you can see that. And so wound debridement 11042 through 11047 are reported by depth of tissue that is removed and by surface area of the wound. These services may be reported for injuries, infected wounds, and chronic ulcers. When performing debridement of a single wound, report depth using the deepest level of tissue removed. In multiple wounds, some of the surface area of those wounds are at the same depth but do not combine sums from different depths. So let's look at what they're talking about with depths. Okay, and you have more information that you can read, but I'm just doing just a simple glance over what we have. So if you look at 11000, debridement of extensive, I can't say that, eczematous or infected skin up to 10% of the body surface. So how are you going to know what the percentage is? Well, it's going to tell you in your medical record. Then you add 11001, each additional 10% of the body system. So if they had 20%, you would do 11000 and 11001 because that equals 20%, right? 11004, debridement of skin, subcutaneous tissue, muscle, and fascia for necrotizing soft tissue infection, external genitalia, and perineum. So 1105 is abdominal wall with or without facial closure. 1106 is external genital, perineum, and abdominal wall. And you see how I have circled what it was and underlined? So 11008 is the removal of a prosthetic material or mesh, abdominal wall for infection. That's going to be an add-on code. You always need to add something to that. Here we have some more debridement codes. Then if you look at, I'm sorry guys, let me move it over. 11042, debridement subcutaneous tissue includes epidermis. This is the first 20 square centimeters, and this is additional 20 square centimeters. And you can see where I have written that. And I have circled subcutaneous tissue. Well, when I come over here, this is debridement also of muscle and or fascia. And so I circled that. And this is the first 20 square centimeters, and this is the additional 20 square centimeters. Then if you go to 11004, I circled debridement bone, includes epidermis, dermis, and this only has, well, I didn't write it. This is the first 20 square centimeters, so let's write that. So I'm just going to show you that I write in my book first 20 square centimeters, and this is additional 20 square centimeters. Okay, so let's answer a question here. What if you only had 13 square centimeters? Well, if you look at 11044, it says the first 20 square centimeters are less. So do you guys remember the less than sign? I'm just putting a less than sign there, just to remind me are less, and I'm doing that on all the less, because that way I know that that's where my less is. That's just a little indicator. And the reason that I love this is because when I go back 5, 6 months from now, I'm going to know exactly what that means, and that is going to indicate the word less to me. Okay? So let's go to pairing and cutting. You're going to see that I put a star by pairing and cutting because I wanted to make sure that I knew that this was a category, and you're going to find that I have a little star by each of my categories. Let's go back. Incision and drainage, star. Pairing and cutting, star. Biopsy, star. So this is to report pairing and cutting of benign hyperkeratotic lesion, single lesion. Then the next is 2 to 4 lesion and more than 4 lesions. So I am just going to write single, 2 to 4, and more than 4. Y'all see how I wrote my more than sign like we used in math in elementary school, more than 4. Now, you may not want to write that because it's right there, but I like to write in mine. It sticks in my head when I do. So our next portion is biopsies. What I want you guys to make sure that you understand is you see what I have highlighted. These are definitions over here. This is great information. You need to read through this and skim through it and just highlight important information. Now this is a tangential biopsy, shave, scoop, solderize, and curette. Well, when you turn your page over, that's the first part of the first part of coding you're going to see. But this over here, your notes are going to tell you what that actually means. Then you have punch biopsy. Then you have incisional biopsy of skin. And then over here, we have another star, which gives us our category. Underline it. Removal of skin tags. So if you see here, you have little notes, and it says removal by scissoring or any sharp method, ligature, strangulation, electrosurgical, destruction, or combination of treatment modalities, including chemical destruction or electrocauterization of wound with or without local anesthesia. Okay, I have not done anything with this, so I'm going to do it while you're watching. You can do it with me if you like. So I just want to do this. Now I know this is a removal because it says it right here. Removal, skin tags. So this is the removal 11200 of 15, and each additional lesion or part thereof. So I'm going to put plus 10. This is the first 15, and this is the next 10 additional. All right, so shaving of epidermal or dermal lesions. So I'm going to underline that. And then my notes say shaving is the sharp removal by transverse incision or horizontal slicing to remove epidermal and dermal lesions without a full thickness dermal excision. This includes local anesthesia, chemical or electrocauterization of the wound. The wound does not require suture closure. So I like that, that's important. The wound does not require suture closure. Okay, So when you're looking at this, you have shaving of epidermal or dermal. It's 11300, guys. Shaving of epidermal or dermal lesion, single lesion, trunk, arms, or legs. Okay, do you guys see that semicolon right there? Lesions, lesions diameter 0.5 centimeters or less. Okay, this is what I want to show you. Do you see where this says lesions 15 centimeters or less? Okay, look at 11301. This is lesion diameter 0.6 to 1.0 centimeters. The only difference in 11300 is the diameter. Then 11302, the difference is the diameter. 11303, the only difference is the diameter. So, excuse me. This is what I'm going to do. Now, I want to stop at 303 because the 11305 is something different. All right, and I'm going to use a different color pen just because I want to. I'm going to do my less symbol, 0.5 centimeters. Then here is 0.6 through 1.0, 1.1 through 2.0, and then I'm going to do my greater than sign, and I'm going to put 2.0. Okay, what's the second option to do? Well, you could just highlight the numbers if you wanted to and not write it. That's perfectly fine. I do both sometimes. This is my way. Whenever I go to code this, I'm going to feel comfortable. How many of you have stated you didn't understand E&M and you didn't understand anesthesia? But if you follow my directions and you get into your CPT and you do this, you listen to the lecture, you read your chapter, you do your practice, you're going to be able to understand. But if you're not putting forth the effort, you're not going to get this stuff. All right. So what is 11305? What does that say? Shaving of epidermal or dermal lesion, single lesion, scalp, neck, hands, feet, genitalia, lesions diameter of 0.5 centimeters or less. And I'm looking at the difference between 11300 and 11305. Well, 11300 is trunk, arms, or legs. So I feel like I want to know that. So I'm going to just write up here, trunk, arms, legs. All right, here I'm going to make me a thick line, and I'm going to go thick over here. I'm going to write this under the number, I think, because this is scalp, neck, hands, feet, genitalia, and that's everything that's included in this. Now again, if you don't want to do that, you're going to do scalp, neck, hands, feet, genitalia, and then you can do 5 centimeters, single lesion. So you're more than welcome to do yours that way. However you're going to remember and however it makes you feel very comfortable in doing this. All right, so let's go to our next section. So these are excisions, benign lesions. So, oh, I'm sorry, guys. Let me move it over. There we go. So it's got a measuring and coding of the removal of a lesion. So it's giving you examples, and it's telling you about benign lesions in your notes. And this is excision of lesions. Again, we're in benign. You have to know whether you're in benign or malignant. And here we have malignant. Malignant. And all of these notes. There's not a lot of codes to go through, so it doesn't take long. So go through those. Then you have nails, pilonidal cysts, introductions, which is like injections, repair and closure. And this is where you're going to get some great definitions: simple repair, intermediate repair, complex repair. There's actually definitions within that. Here, you're going to have all your simple repair codes, simple repairs. Then you're going to have your intermediate repairs. Repair complex, and these are your complex repair codes. Skin replacement surgery. Extensive notes. You're going to let's look at the notes under skin replacement. Skin replacement surgery consists of surgical preparation and topical placement of an autograft, including tissue cultured autograft or skin substitute graft. The graft is anchored using the individual's choice of fixation. When services are performed in the office, routine dressing supplies are not reported separately. So good information, right? And I just read one paragraph, and there's two on this. Okay, then here, it's a definitions portion. So that would be great for you guys to read and make notes. So here's some more definitions on this side. And then here is all about autografts, tissue cultured autograft, surgical preparation of the graft, and there are extensive codes in this area. So now we have flaps, skin, and our deep tissue. So we have a very cool photo here of a mid-face flap surgery. We have some notes here. Here's other flaps and grafts. Then we have other procedures. There's dermabrasion here. So that's what this is, dermabrasion. One of my favorite, pressure ulcers. Then we have burns, local treatment, and then we have destruction. Then this is our Lund-Browder diagram and classification method of burn estimations. I'm going to be uploading you guys this document. It's called What is the Rule of Nines, and it's all about burns. So that goes with this. You know what? I am not going to upload that because this graph is pretty detailed. So forget I said that. I'm just going to let you use this graph while coding. If you want more information, let me know and I can send that to you, or you can simply just Google it. So now we're in destruction. So remember, I have my destruction tab here. So destruction, benign or pre-malignant lesion. Okay, well, what were the others? When we were doing excisions, that's excisions. This is destruction. Okay, so this is destruction, benign or pre-malignant lesions. This is destruction, malignant lesions, any method. Let me move it over here. Mohs micrographic surgery. Mohs is very, very interesting. I'll probably put a video up for you guys about Mohs surgery. This is other. breast. Lots of stuff to do with breast. Mastectomy procedures, repair and reconstruction, and other procedure. And that is all of the integumentary system that's in the CPT. I'm sorry, I'm trying to get back to the beginning. So again, I want to point out that you have a table of contents where you can look up a lot of things if you need to. If you don't want to tab and you just want to do it this way, that's fine. But guys, I'm telling you, if you will do it my way, somewhat my way, and get in here and look and read and see what's in your guide, you're going to understand so much more. All right, so now we're going to go back to our textbook for a few minutes. So objective number 2. Oh my goodness, I can't get my, there we go. It says identify the elements of coating, skin, subcutaneous, and accessory structure services. Now, we can do that in the book. But we really did already go over skin, subcutaneous, and accessory structure services. So what are the elements of coating that? Well, let's go to that. Isn't that our very first section? So nails and pilondial cysts, it says to introduce that. Well, we've done that. Let's go to, I'm sorry, I think I've gone too far. Let's see. Well, look for nails, Marcia, right here, instead of searching. So we went to nails, and we have pilondial cysts. And then we have a view of our fingernail. So this is your assignment. I want you to go to breast, which is going to be back here with mastectomy. I want for you to go through the breast section. I want you to read your notes. I want you to write 15 things that you learned just in the breast section. Okay? That is going to be your assignment that goes along with this little lecture. I would love for you guys to give me feedback if this felt like it helped. If you liked this better, since we went to the CPT first, I didn't do much out of the book because this is just a very, very short chapter. Not much to it. It should be very, very easy for you guys to understand. And it also helps to understand that when you're looking at these things, like your flaps that are in the in your book, you can read on that, but you can also read the same things in your CPT. And I'm just going to my flaps right here. So flaps, and then it tells us the same thing over in our textbook that we see in flaps. So as you're reading through your step-by-step textbook, pull out your CPT. Make notes in your CPT. Highlight in your CPT. You guys can do this if you listen to me. You have to know what's in this book. You have to get in. You have to label. You have to highlight. You have to make notes. All right. Well, remember your assignment is I want 15 things that you learn in the breast section of your CPT. It starts here, breasts, and it gives you all kinds of green notes, guidelines, some more here, then mastectomy procedures. You guys should be able to do that easily. Please submit your assignment in your lesson portion of your Edmodo. Have a wonderful day, guys. Talk to you later.